The world is today facing a very serious crisis occasioned by the rapid global spread of coronavirus infection, otherwise known as COVID-19. Over 1.4 million cases have been reported worldwide, of which over 80,000 have died. More than 250 cases have been reported in Nigeria, with about 5 deaths. The President of the Federal Republic of Nigeria has signed a law declaring COVID-19 pandemic a dangerous infectious disease, and strict guidelines have been issued towards containing the spread of the pandemic. The Osun State government and other relevant bodies have also enacted laws to limit interaction in an attempt to slow the spread of the disease. On our part, and in strict compliance with the directives of the federal and state governments, we have requested our staff and students to stay at home except those on essential duties. All staff and students are enjoined to closely monitor the university website and other official channels for updates. We are all in this together, and our support and positive actions will save many lives, while negative actions will put many lives in danger. The following actions are recommended to prevent infection. Practice and promote basic hygiene by washing your hands frequently with soap under running water. Rub your hands with an alcohol-based hand sanitizer where and when there are no facilities for hand washing. Avoid touching your eyes, mouth, and nose as much as possible. Maintain social distance of at least 2 meters, 6 feet, especially from anyone who has symptoms of flu, coughing, sneezing, running nose, and breathing difficulty. Cover your mouth while coughing, sneezing with disposable tissue paper or with your elbow. Follow non-touch breathing techniques. Wave hands instead of shaking other people's hands. Wear a mask, especially if you are sick with flu symptoms or if you are taking care of someone who is sick. Surfaces like door knobs, door handles, tables, desks should be frequently cleaned with hypochlorite solution. Avoid all social gatherings, including religious worships, wedding and reception parties, inaugural lectures, processions, conferences, workshops, concerts, crusades, and competitive sporting events until further notice. Avoid social visits and courtesy calls at this time. Stay at home as much as possible. Suspend all non-essential travels, both domestic and international. Please inform the university upon return from a foreign travel and self-isolate for a minimum of 14 days. Avoid visiting the health center at this time, except it is absolutely necessary. And please contact the health center and other designated outlets if you experience symptoms of cough, fever, and chest pain or breathing difficulty. Finally, it is important to avoid the spread of fake or unverified news through social media or other channels. This has grave health and national security consequences and should be avoided at all costs. Let us remember that every dark moment is transitory and there is always light at the end of every tunnel. This time will definitely pass if we comply. We shall overcome. Thank you.